Good morning for those in this region in the Americas. Good afternoon for the rest. Good night to everyone that is connected with us. It's very nice to be here today talking about something that is very important and is something that affects a lot of people, unfortunately. We have a pretty high number of statistics for suicide. 7,000 people every year commit suicide. Is something that it doesn't affect one person only. One person is suffering, but then it escalates, and many others will have, as a consequence, will have also a lot of suffering. So today we have here in our panel uh, two people from the National Societies. We have Sylvia Jacobi with us. She is the Health and Mental Health and Psychosocial Support Focal Person for Suriname. We have also here Akisha Benjamin, who is the MHPSS team person in Trinidad and Tobago. We also have here Dawn Bean, which is the health focal person for the cluster in the Caribbean Trinidad and Tobago cluster. We also have here today Dr. Fernando Zigman, who is a doctor in Argentina, working as a health advisor in the UNICEF Argentina. We have also Andrea Espiridu, who is a clinical psychologist working as a mental health and psychosocial support consultant for UNICEF in Latin America and Caribbean region. And we have also Michelle with us, who is one of the wonderful people who works for us in this reference center of the IFRC, providing us with amazing material. So without any further ado, we are going to start. We have some questions for each of the participants, but you as well that is connected with us can make your comments, can also have some questions for our participants, and we are more than welcome for your comments and questions. We are going to start with Andrea, Dr. Andrea Espiridu. Thank you very much for being here. Andrea, there is some research that suggests that suicide attempts have increased during the pandemics. From your clinical perspective, how can we mitigate the effects of the pandemic on the incidence of suicide?
Thank you very much for having me. It's a pleasure to be here today on this very important topic. I think this space is great to open the discussion on a very hard issue, and it's great that IFRC is providing us this space. Well, I think starting from the first part of your question, Esther, the numbers are not, clear because we don't have really very good statistics on the prevalence of suicide in youth and adolescents before the pandemic. So it's really hard and maybe tricky to say that the prevalence is increasing. However, we've seen that PAHO, the Pan American Health Organization, who is working and tackling this issue in the region, is reporting some almost 100,000 deaths by suicide for the year 2019, which is very alarming because this means that there are many other, maybe 20 times more suicide attempts. And this is only in the general population. We're not talking about children or adolescents. I think the issue is that there is a lot of taboo stigma around suicide and people do not talk enough about it. And by not talking about it, there is no space or way of preventing it. So I think we need to start from raising awareness and kind of normalizing mental health problems as any other health problems that people feel free to talk about, to seek help, to go to see a doctor. It should be the same. People should be open enough and feel free to seek help for mental health issues. And to do that, we need to have involvement from many different sectors. It's not only a cultural issue because it's the same in many countries across the world. It's an issue that needs to be tackled through governments, through policymakers, through education, and many times through religious sector as well, because all these entities, all these sectors have a very important role to play. So tackling taboo and stigma around suicide is a first step in opening the discussion and allowing people who are dealing with challenges related to suicide thoughts or ideation to be able to seek help. And then as a second step, we need to ensure that help is available. We know that in our region, mental health services are quite limited, and they are only in many countries, and I know we're talking today with the National Societies of the Caribbean. I know from my experience that many countries only have available services in the tertiary sector. This means in big psychiatric hospitals or psychiatric wards within hospitals. But psychiatric care should go public, should go out in the community. It should be within primary health care, within small community centers. It should be a theme of discussion. Health education and mental health specifically should be a theme for discussion within the education sector from very early stages, because children are also involved and are also can be affected by whatever is happening in our world. Through UNICEF, we are about to launch the State of the World Children report, and we've seen that the pandemic has really played a key role in impacting children's life as much as adults, or even worse, because children lost access to education. And for many children, education was their only safe haven. It was a place where they could get not only education, but a place where they can talk to a trusted adult, a place where they can be with their peers and get support from their peers, a place where in many cases they would get a meal that they might not have in their house. So we need to take into consideration that children are not exempt from everything that is happening in the world, and it can really impact them in the same way that it can impact their family, their parents, and their communities overall. So I think we really all need to work together. We need to do pledges, and we need to raise awareness, and we need to ask governments to act to put more investment in mental health. And we need to open our minds and hearts and be able to listen really to those people that might need to talk. And we need to find ways for them to have access to quality mental health care wherever they are. So this is, I think, my answer to you. Thank you.
Thank you. Thank you very much. I think not just me, but all of us can agree with Dr. Andrea. Very well said. It is something that we need to tackle, starting from raising awareness, from talking, from discussing the issue, from breaking the stigma. And with that in our minds, I will have a question for Dawn. Hi, Dawn. My question for you is related to stigma. So we know that there is a lot of stigma preventing people to seek for help. So, and talking about suicide is something that is a taboo. It's still a taboo. There is a lot of cultural shame surrounding the theme. And for that, I want to ask you your experience in the Caribbean region, in Trinidad and Tobago, where you are based. How is it? Is it still a great taboo? Is it starting to see the light of the day? How are things over there?
Okay, thanks, Esther. So, well, the Caribbean, as many people might think or know, is known to be this happy, beautiful place, and to an extent that is true. But I also want to build on something that Andrea was just saying in terms of the statistics in the region, and looking at them, even I was quite shocked. So what I did see is that the world's lowest suicide rates apparently are seen in the Caribbean, and this is with Antigua and Barbuda, Barbados, Grenada, and St. Vincent and the Grenadines, showing the top 4 lowest rates globally. And this was in a review done in 2019. So this is prior to the COVID-19 pandemic. However, conversely, Guyana is has the second highest suicide rate in the world after Lesotho, which is in South Africa, and then Suriname takes the 8th place globally. So if you think these are global statistics, but then if you think of the region, Guyana takes 1st place, Suriname takes 2nd place, and then Trinidad and Tobago comes in 3rd in terms of suicide rates in this region. So the challenge is a significant one. And to speak to this issue of taboo, we understand that it is alive and well. So much so that another piece of research done in the region recently indicated that some of the most frequently mentioned barriers to seeking mental health issues was stigma and the shame related to suicide. So what is also shown is that research takes place in high-income countries, and therefore this is not reflective of what happens in small and developing states in this region. However, in terms of recommendations towards breaking the cycle, they can focus on investing in further research on the issues that prevent suicidal persons from accessing mental health services. It can focus on targeting suicide prevention within psychosocial programming, including intervention that reduces stress and the shame associated with suicidal thoughts. We could also consider the importance of integrating suicide prevention efforts within the school system by building the capacities of teachers to recognize and refer children who they feel may be at risk. We can encourage stakeholder involvement, and this is encouraging the Red Cross to get involved in suicide prevention efforts. And this is particularly important given the level of distrust that we have in this region towards public mental health organizations or services. Just as Andrea said as well, a lot of these services exist within the tertiary sector, and even those are not trusted by communities because, again, of all of the stigma and the shame associated with it. We can also consider non-traditional mental health support systems such as peer groups, and this is within the context of Caribbean communities, as I mentioned, that have limited resources. And it is also key to make persons and communities aware of whatever systems that exist, because even if they do, persons are either not sure, not aware, they're impacted by the stigma. So again, they don't access services that exist. So we can implement, and this is something that Trinidad Red Cross has done, for example, information such as hotlines and emergency contacts, make persons aware that these services exist so that they can access it when need be. And then finally, we need to talk to our media houses, and this is the national media, social media, to ensure that they're more careful when they report on suicide death. There's a tendency, I find, and persons can speak, colleagues in the region can also speak to this, of a kind of oversimplify, they oversimplify the explanations as related to suicide events. And at the end of the day, there are a number of complex factors that contribute to the incidence and the challenges of persons who have resorted to this area. So again, we need to talk to our media houses and even explain to communities better how challenging this issue is, and that hopefully will deal with some of the taboos that are aligned to this problem in this region. Okay. Thank you. Hope that answers the question.
It did, indeed. Thank you, Dawn. Thank you very much. And it's true. I mean, the numbers are alarming, and we already have a way, that we see that we have to tackle some things along this way. So I believe now it's time for action. And building upon that, I would ask for the representatives from the National Society, Sylvia and Akisha, in this order. What are your thoughts as a movement? What are you doing, or you see that you could implement to assist in this matter?
What greetings from Suriname. And the that we integrate the concept to about everything. And it's not like that people think there is a balance. But broadcast what we are doing to fix this meeting. It's not very mental. So we are trying to take away this news so that people can see that it's normal.
I'm sorry to interrupt you, Sylvia, but your audio is not so clear.
Can you hear me
So
better?
yeah,
Do you hear me?
a little bit. So I think we can move to Akisha while you try to work on your audio. Akisha, please.
Okay, sure, no problem. Good morning, everyone. Greetings from Trinidad and Tobago, wherever you are, and of course, virtual hugs. I guess it's just a bit matter of tying into some of what Dawn and Andrea was saying before, and also I was getting a little bit of what Sylvia was kind of alluding to. That when we are looking at programs or anything around the whole idea of suicide, we have to start looking at some of the factors that are involved. For example, if we're looking at depression, um, and all those other stressors and stuff that may contribute to someone wanting to to use suicide as an end result. Um, it's going to take us a lot of work to get to that, as Don was saying, as beautiful as the Caribbean are, and as warm blooded and as beautiful as we think we are. We don't really believe in things such as being depressed and being sad. It's something that's new to us. In that the concept, I should say, is new to us. Um, so maybe that's something that we can address in terms of looking at some of the misconceptions that we have surrounding suicide as well as mental health. Because if you ask the average Trinidad or Tobagonian mental health, the first thing it creates in their mind is that you're crazy. There's something wrong with you. You know, so even we can start the conversation from as little as that. Um, some of the strategies that we have used at our national society is creating things that people can use, like coloring books, teaching people how to journal, teaching people how to get in contact with their emotions and their feelings, and of course, providing that service that they can reach out for help by calling the hotline or messaging the different numbers we have available. And we, for ourselves, can be that technical support to get them into our mainstream system here in Trinidad and Tobago, because we do have mental health units and we have other organizations that have set up COVID response lines and mental health lines free of charge that they can tap into to kind of get the help and the services that they may provide. It's a lot of work because it's a whole cultural mindset reset to not acquaint being suicide with being weak or being helpless or being stuff like that. But maybe looking at it as anything else, as an avenue for some persons to relieve pain.
I think now we lost Akisha.
Relieve suffering. And more than ever, we are seeing that now in Trinidad. So definitely my top three would be one, programming that definitely looks at misconceptions surrounding not only depression and suicide, but other factors that may lead to suicide. Two, definitely looking for tools and tips and equipment that we can be able to supply. And definitely three, referral, getting persons into the different various systems that they can use to access help. So definitely that would be my top three. So I hope I'm not taking Sylvia's top three as we kind of pass back to her if she sorted out her audio issues.
Thank you, Akisha. Thank you. Brilliant. Your top three for sure is the top three of many national societies. So I wouldn't be, surprised if he's the top three for Sylvia as well. Sylvia, you can go ahead.
Do you hear me now? Hi, do you hear me?
Is your voice is breaking a lot, so we cannot understand very well.
Okay, and now it's
Sometimes it's okay. Okay, so let's move on, and I will make it then a question for Dr. Fernando, who is here with us as well, because I wanted him to get a sense of what people in the region think, so he can build up on that as well and give his contribution. Thank you very much for being here. And our question for you is, in your experience in Argentina, because you have been working with this issue for a while now, how can we act to address and prevent suicide? You are on mute, maybe?
Sorry, thank you for the invitation. It's great to be working with you and to agree so much on all the things you were saying. From our work in Argentina, I can say that we went through three axes, three paths to address the suicide-related events and the suicide issue. And I will talk about them, but not in a hierarchical way. You can change the order. But one of the axes is knowledge. Suicide is an issue that we don't know so much. We must know better about the processes and what's happened with the suicide. 20% and between 15 and 20% of adolescents everywhere thinks about suicide. And that's a regular survey that who develops with PAHO in Latin America, with UNICEF, school-based surveys show us that is very common issue. And we don't know why. We don't know which are the drivers. So build about knowledge is very important, but not only knowledge about the issue itself, but also about statistics. We don't have statistics, and we don't have statistics to know if it is an epidemic breakthrough, something that happens, or if it's something that happens, or if it's transmitted. And we don't know if there are places with higher prevalences. We don't know. In our countries, maybe we have general numbers and underestimated numbers. So data and statistics are very important to prepare the system to address. And the system must be, and this is other acts, prepare the system. We should have a public health approach to this issue. So with data, knowing where it happens, when it happens, which are the more affected people in a more deepened knowledge, allows us to prepare the multi-sector response that should be built. And I have been working with adolescent population, so we can say that identifying which are at more risks, not avoiding stigma, but we know, for example, that there is a significant number of people suffering with that previously diagnosed mental health disease that should be well followed to get their medication, to get their company and good care. And if we can address this group of population, maybe we can prevent a great number of suicide-related events. And also, for example, address the people that attempt suicide. This is another group that we can identify because they reach the guards and they reach the emergency rooms at hospitals, or they can be identified, and we should give them an adequate follow-up, because they are people that is telling us they are telling us that they are suffering. So we should prepare the system to address, for example, these two groups. But there are other groups that we know, not so well identified, but for example, people that suffer domestic violence. Early domestic violence is a driver to suicide events, and sexual violence is also driver to suicide events. So working on in these issues, in these fields, also prevents suicide, and we should do that. And also very strict and rigid structures, family structures and community structures, for example, drives to suicide related to gender issues, identity, sexual identity, or religious identity, that if when don't fit in their places, maybe they are driving to attempt suicide or suicidal thoughts. That's information that we find in our investigations, that you can find in our page, in UNICEF page in Argentina. So a driver approach, identifying people approach is very important. A public health, mental health approach is also very important, and prepare multi-sectoral services. For example, and that's very important to say, that people need places to where they can express themselves, where they can find real listening, not hearing, listening. You mentioned it. People, but to do that, we can allow them to speak. And system and people with authority should talk about suicide, because talking about not only, make that we are not sweeping under the rug the issue. We can talk about, we should talk about, but talking about suicide, we are allowing other people to express their concerns, and that's very important to reach help. And because of that, we need to train health workers to listen. We should train teachers to listen. We should train social workers to listen, and don't be fear of talking about that. That doesn't mean that we should regulate, media communications about suicide. That's I think that we know about that. So these are the four axes that we should address: knowledge, and that means research, that means data, that means statistics, that means go through and stigma, because we found a big city in Argentina that declared no cases, and that happens because of the justice system and the health system didn't agree who of them will give the final diagnostic. So they didn't agree. So the death certification doesn't have a proper diagnostic. So no registering about the suicide in a big city is available. So knowledge, talking about that means an allowance to people to speak, identifying groups and identifying drivers, and a multi-sectoral approach. These are, I think that the things we should do to address suicide in our countries. Thank you.
Thank you very much. Thank you for enlightening us, because it's exactly what you said. We see things in front of us, but there are things also very much intrinsic into the politics, bureaucracy, and other things, services providers, that we sometimes tend to ignore, and they are very important because they are the foundation for everything that we do. And I want to hear also from the movement. We have today here Adrian Reed is our representative from the Youth Commission of the Jamaican Red Cross. Thank you for being here. And I want to hear your thoughts about the issue that so often is also connected with the youth. So how do you as a movement, as National Society and Youth Commission have been addressing the issue?
Hi, good day, everyone. All right, so as it relates to the Youth Commission, what we have been doing a lot is we have the support groups, for example, the call-in lines that persons can use, if they need some form of, somebody to talk to that, maybe an anonymous kind of setting, they're able to call in. Locally in Jamaica, we have trained persons in social psychological first aid. So we have a lot of persons in different communities to ensure that we have persons in the different communities that are trained in psychosocial first aid, so that they're able to then provide persons within their communities, or if it's a case where somebody from outside of the community wants to speak, then they can always call in, or in a socially distant kind of setting, they can actually go in and sit down face to face with the necessary distance, of course, to speak about whatever issues they're having. In the school groups, we would have settings like persons are able to speak to their teachers. If it's on a one-on-one kind of basis, they have their contact numbers and so on, that they're able to then sit down and speak with them about what can be done, or what they can do to help themselves in coping with the pandemic. We have had a lot of webinars as it relates to dealing with mental health as well. So we do surveys to see what the standing is of persons across the region about their as it relates to their mental health. And then from there, now we see what methods can be put into place to actually assist the different realities that exist in the different countries. Outside of that, we encourage persons to take on things like different hobbies. So persons will go into things like exercising. Some persons are encouraged, homes are in their different countries. So these are some of the things that have been done so far as it relates to encouraging persons to take care of their mental health. Thank you.
Thank you very much. Keep up the good work. And I wanna follow up on you. So, do you think that for the youth is easier to talk when there is someone that they can relate age-wise? Like you are also someone that is young, so they feel more comfortable to talk, or when they talk with teachers, for example, that you mentioned, is also the same?
Well, it all depends on the situation. In some cases, some persons do trust their peers, yes, but in other cases, we usually have that one teacher that we can go to about anything. So in most cases, that is where those teachers come in place. So we have them trained. A lot of schools have been focusing on having their teachers getting some form of guidance, counseling kind of training, or psychological training at some point in time, so that they're able to then deal with any situation that their students may come to them with. So yes, the peer-to-peer setting is usually easier in most cases, but in some cases persons may not want their peers to know that they're going through these problems. So this is where the teachers then come in play. Thank you.
Thank you. Thank you very much. Now we are going back to Sylvia. Let's see if your audio works.
Hi, does it work better now? Okay. Yes, as I was mentioning, is that what we do as Red Cross, as Suriname Red Cross, is that we try to incorporate it in everything to normalize it, so that people do not feel the taboo and do not come to us. So in every activity we are conducting, as right now we will be conducting a vaccination program with a medical mission. People in the communities will be trained in basic psychosocial support methods, so that they are the first persons in their community where people can go to, that they see the signs and they start talking to people. As the doctor was saying, that we should not be only hearing the people, but we should be listening to know what's happening in their mind, and to normalize it. I see that one of the things that happens in the country that's very positive is that now in your insurance, that you can go to the psychologist or psychiatrist, and it is in your insurance. What that wasn't before. People had to pay
separately for that, but now they can, I think 10 times you can go. So people are trying to normalize it. We are also trying to incorporate it. So for us, it's integrated in every activities that we are doing, starting from our volunteers to the people we are working with in the community. Even though sometimes we do not mention that we will be doing psychosocial support activities or mental health, but because we are working in the community, we know the people. If we notice something, we start talking to them, and that's what we are teaching them also.
Thank you, Sylvia. Thank you. That's great because you mentioned the foundation of our movement, which is the community-based service. And rounding up on the work that we do as a movement, I want to have the question for Michelle, who is our spine, let's say, in the movement, because she is working in the reference center, which provides us tools, trainings, facilitates a lot of things that are happening in the context, and they provide to us so we can support national societies, and the national societies can support the community. We have a guide that was developed into the reference center. Is a guide of suicide prevention. And I want to hear from you, how do you see the practical side of the work you do?
Firstly, thank you so much, Esther, for such a kind introduction. And thank you as well for hosting this webinar. It's such an important topic, so it's really a pleasure to be here today amongst all these panelists. You very rightly pointed out the suicide prevention guidance that we have available, and we actually have two different versions for it. One is specific to the COVID-19 pandemic, because we were hearing a lot of national societies were concerned about suicidal behaviors during the pandemic. And then one is also general guidance for suicide prevention activities that occur as part of normal programming. These resources are available on the Psychosocial Reference Center webpage. They're available to Red Cross and Red Crescent Movement, but they're also available to other organizations and community members who are working in this space. The guidance in particular that looks at suicide prevention is really focused for anyone who's working within the community. It's intended to give practical guidance for how to support persons who may be having thoughts of suicide. And it's really interesting and really thought-provoking to hear all the panelists today speak about stigma and taboo and how challenging it is sometimes to have these sensitive conversations around the issue of suicide. And that's something that's focused on quite heavily in this guidance document, actually. It talks about what are the necessary skills that people need to have to start, to even just start the conversations around suicide. So it looks at basic helping skills. It looks at psychological first aid, like how to respond to people who are in distress, and to how to ask people about potential thoughts of suicide. Like Dr. Fernando pointed out, it's really important to have these open conversations. And so this guide provides a bit of a framework for how to do that. There's also a host of other resources within the guidance that are intended to be very practical in their use. So within the guidance, it includes, tip sheets on how to identify people who might be at increased risk of suicide. And it also includes key information about how to refer persons who might be at risk for suicide to various different organizations. We've talked about the importance of linkages with other services, so the guidance focuses quite heavily on that. And there's also a lot of information about how to respond to persons with thoughts of suicide. So there's safety planning tools that you can actually take and use with people that you may be working with. And there's also links to a host of other resources that are maybe more specific to particular populations that could be at risk. So, that could be men, for example, who tend to have higher rates of suicide from what we can see in the research, but also persons with disability, older persons. So a lot of that information is included. We tried to really simplify it just to give you a bit of background to how this guidance document was created. Everybody's talked about, how there really is a lack of research on this topic. And what we did to create this is we really tried to dive into all the information that was available. And we tried to really make it into something that's understandable and relatable, and that actually can be used practically in meaningful day-to-day activities. So that guidance document is available on our website, but we also have some other guidance documents as well that could be of use to people who are working in this space. So for example, we know that people who are working with people who may be at risk of suicide, it's a stressful position to be in. It can put a lot of strain on staff and volunteers who are working in this space. So one of the things that we have available on our website as well is a guidance document that talks about the importance of supportive supervision for staff and volunteers who are working in mental health and psychosocial support more broadly. And within that tool, it also includes a lot of practical ideas for how to support staff who are working in this really sensitive topic. And then we also have, just informal podcasts where persons who are experts on the topic of suicide prevention come and have discussions with us about, what are the most effective responses, what do we know about the scale of the issue, and how can guidance documents like the suicide prevention guidance document be used. And we also hold webinars and occasionally workshops as well to train people on suicide prevention and to support people to start to have these difficult conversations. Within that guidance document as well, there's some guidance on the media, because a few people have raised that how suicide is talked about in the media can actually be quite problematic at times. So the guidance document also provides some information about how to provide education to media about appropriate terminology to make sure that we are targeting issues such as stigma and taboo head on. And really importantly, what we're focusing on is that community care element. So the guidance is not intended for specialists. It points out when specialized training is needed, but it's really focusing on supporting people who may not have that specialized training, but who are still coming face to face with people who have thoughts of suicide. And it's really focused on those basic helping skills that are so important in this area.
Thank you, Michelle. As I mentioned, is the backbone of our movement, and based on everything that she said, you can understand why. And it is the core feature of our actions as a movement, is to have community-based, is to have the community having resources to be able to take care of themselves and to be able to be sustainable. And the movement, this reference center has lots of resources that have this quality for the community, which is easy to access, easy to read, easy to get an understanding. And it is a very also consistent resource that the community can use to empower themselves. And now I want to open the discussion. If anyone has a question for each other, that's the time, so we can have a little bit of a discussion. I really have to thank you all once again, because your contribution in this panel was amazing. Thank you. And I want to hear from you. Maybe I call names because it's going to be difficult. So Dawn, you are the first in my screen.
Okay. I suppose I have a question for Sylvia, and this is only based on the startling statistics that I saw for the highest suicide rates in our region, to not necessarily be within the islands, but they are in the CARICOM countries of South America. So I'm just wondering how that impacts the work that the National Society is doing, given that there are seemingly significantly high rates in those two countries. And this is Suriname and Guyana. I don't know if she has any, I'm just wondering if she has any comments with regard to that. If she's able to come back on.
Yes, of course. Yeah, here is Sylvia. So you have to repeat the question.
Oh, Sylvia, I was just wondering about the statistics that speaks to some of the highest rates of suicide in the region, being in Guyana and Suriname as opposed to the islands. So I was wondering if the National Society responds to that, or how that impacts your work, or even if it's an issue that you've realized in terms of the work that you're doing with regard to suicide prevention specifically, if any.
One more. I was missing.
So, can you hear me?
Yes.
The statistic speaks to some of the highest suicide rates in the region, being in Guyana and Suriname. So I was wondering how that impacts your work at all, or if there's any work that you've done previously that targets this, or even if your healthcare system supports, addresses these statistics in any way.
Okay, yes. We have one of the highest rates in the region. It hasn't affected our work because it's different. I'm hearing twice. Can you hear me good?
Can you repeat what you said?
I said we have in the it isn't affected as much because and still we focus on in the state for a lot and it incorporate that and talk about what mostly what's suicide happens that since I don't even know from the pandemic, so I cannot talk about the higher because most in the history of
Thank you, Sylvia. Unfortunately, the connection is a bit of a problem today for Sylvia, for Dr. Fernando, who was also having some issues. But thank you for replying to Dawn. For what I understood, she was saying that it's different for them in the field. So the numbers are there, but they don't experience the numbers every day. That's what I got from what she said. And I want to know if Adrian has any questions for any of the participants.
Well, my question would have been as it relates to the resources from the PS Center, but I see Michelle has already shared the link with us as it relates to what resources are available. So we will definitely make use of these in our work here in the Jamaica Red Cross. I'll share it with our team, and we'll see how best we can implement it and modify where necessary to apply it to the youth, and of course share with our regional counterparts as it relates to the Youth Commission. Thank you.
Thank you. Thank you. Michelle, do you want to reply and also make a question?
Yeah, absolutely. And just thank you, Adrian. That's wonderful to hear. And of course, the center's available. If there's any questions that you have after going through the resources, always just reach out. I actually have a question for you. So that worked out very well. My question was, it was really interesting to hear about all the different activities that you're doing with youth. And it's just, amazing work that's being done there. And I'm wondering, because that can put a huge strain on youth sometimes, providing peer support on such a sensitive topic. And I'm just wondering, what what is done to support the youth who might be engaging with their peers on the topic of suicide?
Okay, well, I should actually clarify about that part. As it relates to the youth that actually do the interventions in most cases or assist their peers, it's mostly the older set of youth that we work with as it relates to this kind of training. So our college students, for example, they're the ones who are usually in place to assist the younger students, whenever they're having issues. So honestly, I think what we do mostly is just like regular sit downs with them. So the head of the PS unit in Jamaica would usually have sessions with staff and volunteers, where I think this is usually done, or mostly was done like once or every other month, once per month or every other month, especially during the earlier days of COVID. So we used to have these sessions where we would have discussions back and forth, and then she would then go through like breathing techniques as well as other forms of coping activities that we can use in the setting that we were virtually. So wherever we were able to then sit down and then do these exercises that would then assist us in alleviating our own stresses. So this is one of the things that has been done so far. We actually need to step up the game a bit more as it relates to doing more activities that can then help to support our team members. So far that's what we've been doing, but we need to definitely do more to assist persons, especially our younger persons. We need to do more as it relates to them. Thank you.
Thank you very much for answering that. And it's really great to hear how practically focused those sessions are in terms of teaching skills like relaxation strategies. That sounds like that would be very helpful. So really nice to see that that's been done. Thank you.
Thank you. Akisha, do you want to make a question? But I have another question for you. You mentioned the helpline. How easy is for the people who be free, since we are talking about taboo and stigma, to talk in the helpline about suicide thoughts and this thematic?
Okay, so thank you very much for your question, Esther. It is a private and confidential line that is run by persons who are trained in psychosocial support. We have persons who come with counseling as well as social work background. So, and before we developed the hotline, what we did is that we actually sat down and had a referral pathway that we created. So we know that if persons call with various questions or stuff that may be beyond the scope of what the headline can provide, then we know to refer and get them into the system or refer them to an organization that treats and deals with suicide and suicide thoughts and that sort of thing. So basically, that's one of the methods that we use in terms of being able to provide assistance to persons with suicidal thoughts and that sort of thing. And obviously, if we do, like Michelle said, we do have persons that follow hotline with various topics that they want to cover. So on our end, we also try to do relaxation techniques and stuff like that with our volunteers, to try to kind of take away from some of the stresses that they may be going through, because remember, they are volunteers and they also may have full-time jobs and other responsibilities. So that's something that we also have to pay very much attention to, caring for the carers, and then being able to manage some of those things. We have very good working relationship with our mental health unit here with the Ministry of Health, as well as Lifeline, which is a non-governmental organization whose sole mandate is to have a hotline for persons who may have suicidal thoughts or maybe have attempted suicide before. So we really do have a really good working relationship with them. So they know that if they get referrals from the Trinidad Red Cross Society, it is because the persons maybe have been screened and are displaying those tendencies, and they refer them so their officers and their social workers can make that one-on-one connection and that sort of thing. So I hope that answers your question, Esther. And I do have a question for Adrian. Actually do have a question not written down. I'm not sure if you mentioned in terms of Jamaica Red Cross that most of your peer-to-peer sessions, is it done face-to-face or is it done virtually? because I know in the Caribbean there's a lot of governmental restrictions and curfews and stuff like that. So I'm not too sure if it's similar for you guys there. So I don't know if you could probably give me an example of that. Thanks.
Thanks for the question, Akisha. Mostly it is done virtually. So either over the phone or in a more like a Zoom setting or something along those lines. So for the most part, it's been virtual because we have been through a lot of lockdowns and so on right now. So it's mostly virtually done. But in the earlier days of COVID, though, we did have some sections of the country that were to some extent still open. So in those times, we would have been able to do more, maybe a small scale face to face. But now it has been or become more virtual.
Thank you. Well, our time is ending. Thank you once more. I cannot thank you enough for being here, and not just for being here, but for the work you do. Thank you very much, Akisha, Adrian, Michelle, Dawn, and the others that unfortunately had connection issues or other commitments and had to leave. I want to thank you. Our partner UNICEF is an entity that we work together in the field and do an amazing job for having representatives here. And thank you for the national societies, which are doing an amazing job. You are part of the community, and as a part of the community, you take responsibility and you empower your community. Thank you very much. Thank you, Dawn, for supporting us in many things, and not to say everything. And Michelle, you work in our backbone, so thank you very much for providing us with everything we need to do our work. And don't be afraid of your thoughts, of your feelings. Feel free to talk. There is always someone who will listen to you and not shame you. So we are here as a movement, as a community, to embrace you. So if you have any issues, please do not hesitate and search for help, because help is there. So thank you very much for all of you, and I hope to see you in other events.
I wanted to say thank you, Esther, for your support as well to the region. We're all very grateful and again thankful for the support that you provide to us. So hats off to you.